Hi, this is Dr. Susan Brown at the Center for Better Bones. It's my great pleasure to have with us today my friend and colleague, Trisha Torrey.
It's great to see you, Susan.
Welcome, Trisha. Trisha is a business development specialist who was thrown into a rather dramatic life transformation, really, due to a misdiagnosis. One of the outcomes of this transformation was her book, You Bet Your Life, The 10 Mistakes Every Patient Makes. And even more, in addition to the book, Trisha went on to create a whole new profession, the profession of independent professional patient advocates. Today, I'd like Trisha to share some of her knowledge with us. To start out, could you briefly tell us about your misdiagnosis and how this transformation took place?
Sure. Well, in 2004, when you and I were doing business together on occasion, I was out in my yard and I felt this lump on my torso. It was about the size of a golf ball. Went off to my primary care doctor, sent me to a surgeon. The surgeon removed it. It was very simple. And when I asked the surgeon what he thought it was, he said he'd never seen anything that looked like that before. So that was really scary.
Yeah, wow.
Well, you can imagine then I had to wait for the test results. And when they finally came in, I was told that I had subcutaneous paniculitis-like T-cell lymphoma. Well, lymphoma, cancer. I focused on that, of course. It was 3 weeks before I could see an oncologist. When I finally got into the oncologist, they ran CAT scan, blood work, the whole thing. And when I got the reports, now this is 6 weeks after the diagnosis. When I finally got the reports, they said they could find no evidence of the lymphoma in my body. But I had to start chemo immediately.
Even though they could find no evidence?
They could find no evidence. And I said, what do you mean I have to start chemo immediately if you can't find any evidence? How will you know what you're fixing, and how are you going to know when it's fixed? Well, you have the classic signs of lymphoma, I was told. The classic signs? What are the classic signs of lymphoma? And he said, you have hot flashes and night sweats. Yeah.
And you were actually in menopause.
Well, sure, I was 52 years old. And I said, wait a minute. No, that has nothing to do with it. I'm sure you have lymphoma. Well, now, I was somebody who had never had challenges with the healthcare system to that point, but I decided I needed to get a second opinion, and I did. And my second opinion doctor actually took the biopsy, the lump that had been removed, and managed to send it off to the National Institutes of Health. And when they came back with the verdict, and now this is 3 months after the original surgery, 3 months, what they said was that there was no malignancy. There was no lymphoma.
There was no lymphoma, yeah.
And I never went through chemo. I've never had any form of treatment, and so they were right. Well, at the end, I was really angry. I was relieved, of course, but...
To know you didn't have cancer.
Well, and to know I'd been put through all of that, because not only had it cost all of my peace of mind, it had also cost me every penny I had in the bank.
Wow.
I didn't lose my house, and I didn't lose my retirement. But by a mistake being made like that, it could have cost me not just my health, but everything I had. So, I'm one of those people who...
You were angry.
Hell hath no fury, right? So I decided that I would start reading everything I could get my hands on about medical errors, and misdiagnosis in particular. I ended up writing some newspaper columns, hosting a radio show. I ended up writing a book.
Yeah.
And I also do a number of other things. I speak across the country. But what I discovered was that most patients make the same kinds of assumptions, and they are mistakes on our part. And when we make them, we don't get the care we're going to need.
And one of the fascinating things are these 10 mistakes that Trisha has pinpointed. I'm just going to list 3 of those, and then we're going to talk about how people with a bone health concern can avoid these mistakes. I thought this analysis of the medical system was pretty striking. One mistake is thinking the healthcare system is focused on helping patients.
No.
That's a mistake. Wrong. Number 2 is thinking medical research is searching for cures.
Wrong.
Again, a little hard to hear, but okay.
Yeah.
And then the third one we're going to talk about today is thinking you have been told all of your treatment options.
And not only is that wrong, but it costs patients their health every day.
Yeah, and I think a lot of our people can recognize that they haven't been told all the options. So, Tricia, let's take a minute now and go back and say, how can we, particularly people interested in bone health, avoid those 3 mistakes?
Well, I'll tell you specifically, the way the book is written is what we're going to talk about now. It talks about the mistakes, but then it talks about, if you know about them, this is how you can use them to get what it is you need, all right? So the first thing, I've got 4 tips for your video watchers, the people who read your blog. The first one is to always get a second opinion.
Second opinion.
Yes. So the reason you want to do that is because any doctor who tells you you have osteoporosis, osteopenia, whatever the diagnosis would be, you need a confirmation of that. because doctors have a lot of reasons to diagnose you with something that's expensive to treat. And it's not necessarily to your value if they do that. All right? Yeah, it's scary, but it's about the money. And it's about the money trail, and that's what the book describes. So number one is make sure you get a second opinion, and that you get it from somebody who's totally independent of the first doctor.
Right, that's real important.
Exactly. So the reason you want somebody independent is because two doctors in the same practice, in the same hospital, even in the same city, they could be buddies.
And they can't contradict each other.
They will not contradict each other, exactly. Right. So go across town, go to another city, wherever it is you need to go, all right?
Good advice.
All right. The second one is to make sure that whichever doctor you decide to work with, and you have your choice, whichever one you like better, make sure that you are being told about all your treatment options. So even if they suggest drugs as one of the things you should be doing, they should also be talking about nutrition. Go ahead.
No, that's so important in bone health.
Absolutely.
So the one criteria, they should be talking about nutrition, exercise, lifestyle, and if they don't, then you presume they're not giving you all the treatment options.
Exactly right, exactly. And they should also be saying, or you could do nothing. Now, that may not be the best choice for you, but it is an option.
Right, and often that's overlooked.
Exactly right. So make sure you're told about all of them. If you're not, if you feel as if something's been shortchanged, get online, read what you can, check in with you, however you're going to do it, find out what all your options are. Okay? Because that leads to the third tip, and that is to make sure you're making your own choice. You're not just making the choice the doctor has recommended. And don't think, if I don't decide what the doctor has suggested, that the doctor is going to be upset. If the doctor gets upset, then you need another doctor anyway. All right?
You really need a doctor who will partner with you, and you need to carefully think about what your choice is. Because
right.
I always tell people, no one cares as much about your bone health as you do.
That's exactly right.
And so,
at the end of the day, if you have a problem and you result in a fracture, it doesn't affect the doctor.
Right.
Except that the doctor is going to make more money because now you have a fracture.
Or if at the end of the day you take a drug and that has a whole bunch of unfortunate sequelae, it's not the doctor's problem, it's your problem.
Exactly. So that leads to number 4. Very good, Susan. Number 4 is to make sure you track your progress. Okay,
right.
Say the doctor prescribes a drug and say you decide to take it.
Right.
But it may have side effects. It may make you nauseous. Right. It may lower your energy level. It may make you skittish. Right. Whatever those side effects, whatever those contraindications maybe could be, if they affect you, you need to make sure you go back to your doctor and decide to do something else. What you want to do is find the best balance between what you think your choices should be and the lifestyle you want to have and the choices you want to make. And if you find that balance, then you will be treated well. And that's the partnership you need to have.
You really need a partnership. And the tracking, we emphasize that last tip of tracking your progress, because equally if a person says, look, I'm going to do the Better Bones program, I'm going to do a natural program, you want to make sure it's working.
Exactly.
Whether you do a conventional medicine or alternative medicine, always track your progress.
Absolutely.
So we have 4 fantastic tips from Trisha Torrey. To learn more, get her book, You Bet Your Life, The 10 Mistakes Every Patient Makes. Thanks, Tricia. It's been wonderful. We're all going to get savvy about the medical system.
That's great, Susan. Thank you.
See you all later. Have a great day.